The Biomechanics of Injury. My name is Dr. Kevin Trangle, and I'm here to talk to you primarily about neck injuries, sometimes known as a whiplash. I'm here to talk to you about the mechanics of this, both from an engineering as well as a medical perspective. This is a significant problem. It is estimated that there's over $30 billion spent both in medical care costs and indemnity disability costs for individuals with neck injuries, whether the injury occurs on the job or whether it occurs in the course of a motor vehicle accident or some other episode. It is nonetheless an expensive issue. There are two ways to look at this. There's a way looking at it from the engineering perspective and also the medical perspective. If you're an engineer, you look at it in terms of the mass of the vehicles involved, you look at the speed, and you look at the forces involved. If you're a doctor, you look at it from whatever your particular perspective is. If you're an orthopedic surgeon, a neurosurgeon, physiatrist, an occupational doctor, you look from a medical perspective. There are very few people that have the ability to combine the engineering perspective along with the medical situation and come together with one overall universal opinion. There are few doctors that can do both from an engineering perspective and a medical perspective, and they are different. If you find somebody that has both backgrounds and can offer an opinion in both of these arenas and integrate that opinion, this is a plus. From an anatomical perspective, the doctors will typically look at the disc and the bones and the ligaments. The disc can have herniations, protrusions, or bulges. However, these are not uncommon. 50% of people that have no symptoms whatsoever will have these abnormalities. There can be slippage of one disc upon the next one. These are called spondylosis and spondylolisthesis. This is not also uncommon. We see this in people. A doctor that specializes in this, typically from an emergency room, orthopedic, neurosurgeon, or an occupational background, can help interpret this. However, the engineering perspective cannot be ignored. Engineers look at the mass of the two vehicles, the speed, and the vectors. And depending on these factors, a certain amount of damage can be implicit from these kinds of factors. A physician that can look at both sides, both have the engineering perspective and the anatomical medical perspective, is a unique breed and can offer expert opinion and valued advice in one sitting. We at Kevin Trangle Associates have these backgrounds. We have this expertise. We're happy to assist you in evaluating a case, particularly in a whiplash, in terms of biomechanical forces involved. If you have any questions, want a consultation, please feel free to contact us. We're located in Florida and Ohio, but we actually cover the country.